Well, hello, Facebook land. Happy Tuesday. We are so excited that you are joining us for our second day of our virtual kickoff. 2020 may look a little bit different, but we are just as committed to highlighting and showcasing some amazing nonprofits from throughout the state. And I think today is a perfect example. I'm joined by Alan with Shriners Children's Hospital. Alan, we are so excited to have you here.
Thank you, Patrick.
Thank you for joining us.
Thank you, State. Thank you, our promise. This is a privilege.
Oh, well, thank you. Thank you. If we could just right off the bat, for those that don't know, and I can't imagine there are some people out there, but for those that don't know, can you tell us a little bit about what it is that Shriners does?
Yeah, no, I think what's funny is people know Shriners, they feel good about it, but they often don't know that we are a pediatric specialty hospital, that we focus on complex or very serious injuries that afflict kids. We're not trying to do all pediatrics, because there are lots of great providers that do that. We focus on the things that are rare, complex, or are so serious they require big teams, and that's really expensive in the for-pay insurance healthcare market. So we focus on acute burns, spinal cord injury, and acute rehabilitation, complex colorectal conditions, and then a huge array of orthopedic conditions that include spina bifida and cerebral palsy. And we focus in on those specialties, and we are there for every child. Any child that needs us is admitted. It's only age and medical condition. And that's why we raise money, because those donations enable us to be open to every child.
That's incredible. That is incredible. As 2020 continues to teach us new normals, how has Shriners been impacted by 2020, by the ongoing pandemic?
So that's a great, I think, so the day-to-day, there are a couple of things. On one hand, we have to worry about the safety of our patients, and we have to worry about the safety of our patient families. And so we've taken we've in-house, obviously, lots of screening, lots of prepping. We've eliminated the visitors beyond the parent of each child. And that's important because we need to convey to our patients that they are safe. And for our kids who are in a continuing course of care, their families need to know that they're coming here for an appointment, that they're not going to get exposed to COVID. And that's been a concern. We've done fast track video. So if you don't have to come to the hospital, but we can do an update with you at home via obviously technology like what we're doing right now. We're able to stay in touch with a lot of our families. But the other thing is more assertively reaching out to families that don't know that we're here and we're open. Because what's happened with the pandemic, schools are closed, sports leagues aren't meeting, and so there are a lot of kids either that aren't being prompted to go to a doctor or whose families aren't going to a doctor because of what's happened with the pandemic. So there are conditions that they would benefit from care for that they either don't know they have or the families are delaying it unnecessarily. So we're really trying to reach out and let people know that we're here, we're open, we're safe. And then we talked a little bit earlier, burns. Families that aren't accustomed to cooking are cooking. And so for the first time, they're encountering burns because, scalds are the biggest problem for kids with burns. And so we're having to remind people again, burn prevention, safety in the home, but if you get burned, your child is welcome here at any time.
It's so interesting. It's so interesting. And Shriners, I think in particular, has had a long-standing relationship with the Our Promise campaign.
Yes.
What does the Our Promise campaign mean to an organization like Shriners?
So the Our Promise campaign means obviously critical funding, and critical funding because when you look at our budget, 75% of everything we do is funded from philanthropic contributions. So every single Our Promise donor is a part of providing healthcare to a child. And in the Sacramento region, that means kids in Sacramento, Carmichael, Citrus Heights, Roseville, Folsom, South Sac, Galt. I mean, we're talking the bread and butter communities of those kids are coming here. We're in the Bay Area. So you're talking Berkeley, Oakland, Richmond, Palo Alto, and then as far as Southern California for some of our specialties. Those are actual kids. So Our Promise donors are making sure those kids are getting the care that they need. And over years, not only has those dollars helped individual kids, it's helped us sustain care for so many of our kids are patients for their entire childhood, but it also encourages us. It means so much to know that people who are dedicating their lives to service to the state are caring about our kids. And so that encouragement means everything.
That's incredible. That's truly incredible. So this year, the Our Promise campaign has gone digital for the very first time in its 40 plus years. And what's
Wow.
so exciting about that is, as we talk about pivoting to a new normal, it's made
Yeah.
donating easier than ever. And folks can actually contribute as low as $5 a month. So truly, we're able to meet you where you are.
Yeah.
And I love what you said about each dollar is a child, right? I mean, these
Yes.
dollars are really helping affect change in the great work that you do. Do you have an example of some children that have recently benefited or have benefited in the past from Our Promise contributions?
So I have to pause because I could, there's so many that just want to leap out of my mouth.
Yes, yes.
It's like,
I
oh,
love that.
wow, really? There's a story. There's a young lady, for instance. Her family lives in Lincoln. She was being treated for an infection, and she wound up, as a result, having a reaction to the medication treating her for the infection. She was at a hospital up in the Roseville area. She wound up getting Stevens-Johnson syndrome. Stevens-Johnson syndrome is a sloughing off of the skin. And it's treated very much like a burn. It's excruciatingly painful because it's not just the skin on the outside of your system, but it's also the skin on your organs inside, and it can affect the eyes. And she was a
Oh,
4-year-old girl going through this. The father's work takes him often out of the area for periods of time. So mom with the family was contending with now what feels like a tragic emergency, and what are we going to do? But because we're known as burn specialists and we work again through the emergency departments and throughout the region, let them know we're here. We got the call that this child needed urgent attention, so the child was admitted. Ironically, it was during the month of November, and the goal for the family really was to get the child home by Christmas, if that was at all possible, just because who wants to spend the holidays?
of
And
course.
this was one of those cases where it takes a team. You don't have just a person. You've got obviously physicians, you've got surgeons, you've got nurses, critical care nurses, respiratory therapists. All kinds of specialists are required for this kind of intense care, which is hard to assemble and it's expensive. With everyone contributing, it makes it possible. The biggest complicating factor were her eyes. And so not only were we helping her with the skin, we were saving the functionality of her eyes so that once the Stevens-Johnson syndrome was over, she could then go to the right ophthalmic specialist for her to be able to preserve her eyes. And her eyes are safe. She's got great vision. She's really
Mm.
active today. But that's a tribute to what donations do for us and what our Promise donations do. We are open for those calls that always come, 11 o'clock at night, midnight, when families least expect it. They find us, and that's the kind of ready service we're able to provide because of our Promise donors. And it never fails to get me all excited.
I'm
Because
a little
it's
emotional.
either cry, or get really
Yeah,
excited. And I opt for really
yes.
excited because I'm a messy crier.
If folks are interested in learning more about Shriners, where can they go, Alan? Where can they go to learn more?
So we have a website, shrinerschildrens.org. Try to keep it simple. Shrinerschildrens.org. Two plurals on the Shriners and Children's. There's lots of information, and there are phone numbers there they can call. There's also email if they'd like additional information. The most important message is everyone who's listening, all of you can refer a child. That's the other thing. We are available to all children. So even if you have a speck of doubt or concern, to tell whoever that person is to call the referral line, and they can work with one of our referral specialists, because again, we are open to every child that would benefit from our care.
It's truly amazing. The work that you all do at Shriners is awe-inspiring, and we are so appreciative. Shriners is one of the examples of the amazing nonprofits throughout the state that you can give back to as part of this year's Our Promise campaign. Thank you so much for being with us. We love you, and we support the great work at Shriners.
Thank you. Thank you. Thank you.
Thank you.